Gentlemen, what if an ingredient sitting in your kitchen could support heart health, circulation, and a diet after 50? I am talking about extra virgin olive oil. It is rich in unsaturated fats and plant compounds. But before anyone calls it a testosterone booster or an erection cure, we need to separate nutrition advice from promises the evidence cannot support. This mixture cannot restore low testosterone, reverse erectile dysfunction, or replace medical treatment. Testosterone levels are influenced by age, body weight, sleep, activity, medications, illness, and hormone disorders. Food can support the systems involved, but no kitchen recipe guarantees a hormonal transformation. Before we begin, subscribe and turn on notifications for men's health guidance. Stay until the end because I will explain how to use this blend without taking risks and what habits matter more than any single spoonful. Ingredient number 1 is extra virgin olive oil, the foundation of the mixture. Olive oil provides monounsaturated fat and polyphenols, compounds associated with cardiovascular benefits when replacing foods high in saturated fat. Blood vessels matter for erections because penile tissue depends on circulation. However, olive oil has not been proven to raise testosterone or treat erectile dysfunction alone. Dietary fat is necessary for hormone production, but eating more fat does not make the body produce more testosterone. The benefit comes from improving your diet. Replacing butter, lard, or processed sauces with olive oil can be sensible, especially within a Mediterranean-style eating pattern containing vegetables, beans, fish, nuts, fruit, and whole grains. For this blend, use 1 tablespoon of extra virgin olive oil. Choose a bottle stored in dark glass or metal, keep it away from heat and sunlight, and check that it smells fresh rather than rancid. 1 tablespoon contains roughly 120 calories, so adding several spoonfuls without adjusting your diet may contribute to weight gain. Men with persistent low desire, fatigue, reduced muscle strength, or erection problems should not depend on olive oil as treatment. Assessment may include reviewing medications, checking blood pressure and blood sugar, and measuring morning testosterone when appropriate. Ingredient number 2 is garlic, included for flavor and cardiovascular benefits. When garlic is crushed, compounds react to form allicin. Research suggests garlic preparations may produce reductions in blood pressure for some people, although results vary by product, dose, and health. Supporting blood pressure and health can benefit erections because penile blood flow depends on functioning arteries. Still, 1 garlic clove will not open blocked vessels, create a stronger erection, or raise testosterone. Treat it as food, not a substitute for prescribed blood pressure or erectile dysfunction medication. For the mixture, crush 1 garlic clove and allow it to rest for several minutes before adding it to the olive oil. Starting with half a clove may be wiser if you have reflux, indigestion, or a stomach. Taking raw garlic near bedtime may cause heartburn, gas, nausea, or an unpleasant taste that disturbs sleep. Garlic may increase bleeding risk, particularly in supplement form. Speak with a clinician before using large amounts if you take warfarin, aspirin, clopidogrel, or another medicine affecting clotting, or if surgery is approaching. Stop the mixture if it causes persistent stomach pain, vomiting, rash, or swelling. An ingredient is useful only when your body tolerates it safely. Ingredient number 3 is lemon juice. Lemon adds flavor and provides vitamin C, which supports collagen formation and acts as an antioxidant. Vitamin C is important, but 1 teaspoon of lemon juice cannot transform circulation, boost testosterone, or correct erectile dysfunction. The advantage in this recipe is practical. Lemon softens the taste of garlic, ginger, and olive oil, making the mixture easier to use with food. It may help men replace bottled dressings or sugary sauces with a homemade option. That change can support cardiovascular health when repeated consistently. Add 1 teaspoon of lemon juice to the mixture. Do not assume more is better. Acidic foods can worsen heartburn, reflux, mouth ulcers, or stomach irritation in sensitive people. Lemon juice can also weaken tooth enamel when sipped frequently or held in the mouth. Consume the mixture with a meal rather than taking it as a concentrated shot before lying down. Rinse your mouth with water afterward, but wait before brushing because enamel may be softened. If you have reflux, citrus allergy, dental sensitivity, or a condition requiring dietary restrictions, leave the lemon out or ask your clinician. The mixture can be adjusted without losing its purpose as a nutritious dressing. Ingredient number 4 is ginger, which adds warmth and has been studied for nausea, inflammation, blood sugar, and health markers. Studies have explored ginger supplements in men with fertility problems. However, those findings do not prove that a pinch of ginger raises testosterone, improves sperm quality in every man, or creates stronger erections. Ginger can be part of a diet. Its flavor may make the mixture more enjoyable, and replacing sauces with ginger, garlic, lemon, and olive oil can improve food quality. Any benefit to sexual health would be indirect through health, rather than a boost after one serving. Use half a teaspoon of ginger or 1/4 teaspoon of dried ginger. Start with less if you are not accustomed to the taste. Too much may cause heartburn, stomach discomfort, diarrhea, or mouth irritation. Ginger may affect blood clotting and blood sugar, particularly in supplement doses. Speak with a clinician before using amounts if you take blood thinners, diabetes medicine, or have surgery planned. Food-sized portions are tolerated, but reactions differ. Stop using the mixture if you develop stomach pain, rash, swelling, or breathing difficulty. An ingredient can still cause side effects and should not be treated as safe for everyone. Ingredient number 5 is turmeric with black pepper. Turmeric contains curcumin, studied for anti-inflammatory effects. Black pepper contains piperine, which can increase curcumin absorption. You may have heard that pepper improves absorption by 2,000%, but that figure came from a research dose and is not guaranteed by one kitchen pinch. Reducing inflammation through a healthy lifestyle may support blood vessels and health. Still, turmeric has not been proven to restore testosterone or cure erectile dysfunction. Adding it to food differs from taking concentrated curcumin supplements, which deliver amounts and may carry greater risks. To complete the mixture, place 1 tablespoon of extra virgin olive oil in a bowl. Add 1 garlic clove, 1 teaspoon of lemon juice, half a teaspoon of grated ginger, a pinch of turmeric, and a pinch of black pepper. Whisk everything together and use it as a dressing or dip. Turmeric and black pepper may worsen reflux or stomach irritation. Products can interact with blood thinners and medicines, while turmeric may be unsuitable for people with gallbladder or bile duct problems. Black pepper can affect how drugs are absorbed. If you take medication or have an illness, ask your clinician or pharmacist before using this mixture. Let us discuss how to use the mixture and what to expect. Take it with dinner as a salad dressing, dip, or topping for beans and grains. You do not need to swallow it as a shot, and taking it before bed does not make the body produce more testosterone during sleep. Prepare it and use it promptly. Raw garlic mixed with oil should not be stored at room temperature because bacteria can grow without changes in smell or appearance. If you prepare extra, refrigerate it in a container and use it. When uncertain, discard it. Do not expect stronger erections, higher testosterone, or energy changes within 2 to 4 weeks. This recipe has not been tested as a blend for those outcomes. Its value is that it can replace less healthy sauces and form part of a balanced Mediterranean-style diet. For hormone and erection health, combine eating with exercise, strength training, sleep, weight management, stress reduction, and medical care. Persistent fatigue, low desire, reduced strength, or erection problems deserves assessment. If this video helped you, like it, subscribe, and share it with another man. This information is educational and does not replace diagnosis or treatment from a healthcare professional.